And first off, I want to say thank you to everyone who's joined. And this is the big kickoff for us, a collaboration between IPSR, the Institute for Population and Social Research at Mahidol University, and Junction, Southeast Asian Junction, located at the Bangkok Art Cultural Center in Bangkok. And we would like to thank the Mahidol International Relations Office for their support. We also want to thank Junction, Chan Rosalia Scortino, Kun Renisa Katia Ari, and we also need to thank our very kind IPSR Wednesday seminar team behind the scenes, and also the Mahidol Migration Center Joint Research Unit staff, Yamin, for making this all possible. For today is a big kickoff of our series that we are hoping to do every other month on a Wednesday. So we'll keep you posted on some of our other activities all about migration in Southeast Asia. So first off, I wanted to maybe say a little bit about what we're talking about today and then introduce our guest. And introduce myself. So just so we know, today's focus is really about Singapore's assisted living. Like Thailand, we're all dealing with rapidly aging population. You know, policies that are still in process of figuring things out, right? And with assisted living and practice, these are really new emerging forms beyond traditional nursing homes and individualist kind of domestic care work. So this is a recent development for Singapore itself. Even on December 10th last year, the Ministry of Health had announced that they have a shared stay-in senior caregiving service in which seniors have shared residence and receive basic daily support from a trained caregiving staff. And this really allows people to age in place in their own residence with their communities rather than being sent to nursing homes. This kind of model is really new, I think, for the region. And for Singapore, it's a sandbox initiative, I understand, that was launched about 2023 in September. So it seems like there's been some positive outcomes from this, and I hope to hear more, and including hearing more about how the Singaporean government is doing this, right? What kind of subsidies for, care worker training, what kind of expanded foreign worker quotas are being provided, and what kind of foreign worker insurances for safety in their own occupations and these kind of assisted living situations, just in order for us to understand what's happening in the region. So I hope that this is the beginning of a series of conversations that we can have between different countries in ASEAN now facing very similar demographic shifts and the dependency on paid care workers, especially from neighboring countries in ASEAN itself. Without further ado, I want to introduce our speakers. I'll introduce myself first. My name is Sudrat Musikwang. I am a sociologist based at the Institute for Population and Social Research here at Mahidol University. And today we have two guest speakers and a commentator. We're so lucky to have Dr. Belinda Wee. She's co-founder and director of Good Shepherd Loft, St. Bernadette Lifestyle Village, and the Assisted Living Facilities Association of Singapore. So together with her husband, Dr. Joseph Lee, they pioneered assisted living in 2015, which is now being mainstreamed by the Ministry of Public Health in Singapore. So Dr. Sung Hock Lin is the chief of the Silver Generation Office. It's the outreach arm of the Agency for the Integrated Care in Singapore. It's a leading advocate for active living, successful aging, and Hock Lin holds a PhD in gerontology and is an Alice Lim Memorial Memorial Fund Scholar. He's also a driving force in volunteerism as a national cause to empower seniors to take charge of their own well-being, and and to inspire each other in terms of community care efforts across Singapore to ensure that older persons can live well and age gracefully. Lastly, I'd like to introduce our commentator. Dr. Stephanie Chok is the executive director of Home Singapore. It's an NGO that is dedicated to empowering and upholding the rights of migrant workers in Singapore. And she leads the organization's research and advocacy efforts, which are directed towards promoting structural change to improve migrant worker rights and well-being. So without further ado, welcome. I hope we can structure today is a little bit not traditional. It's much more discussion based. I'll ask a series of questions and you have a short time to answer. And then we're going to open it up to our commentator from Home Singapore and also the audience. So let's get started. For the first question is for Dr. Sung Hock Lin. I wanted to see if we can get a sense of Singapore's current landscape in terms of active aging. You know, what are the plans maybe government may have or NGOs may have with changing our sense of what housing arrangements may be? What's the role of foreign migrant workers, especially when it comes to the care of autonomous older persons? I mean, has it been pretty much only home-based care, or is it nursing homes? What is it exactly?
Mm. Thank you very much for having me. I'm Hock Lin. Thank you very much. Really privileged to be here. And to all my Thai friends, Saurika. And I want to say first, 2026 is just a start. So Happy New Year to everybody. And this 2026 is also a defining year for Singapore. It's where we are, it's defined as a super age society where more than 21% of our population is 65 years and above. So that's what it means to us. And from a national policy, I would say that the government, together with the communities, have actually did a lot of work in for quite some time. And in recent years, there were two major national campaigns that was started. One is Healthier Singapore, which is anchored on preventive health. Uh, because while our life expectancy have reached to 85 years old, particularly for women, for men is 80 years old, so average about 83. Our unhealthy lifespan is at the tail end is still 10.5. So that is one of our effort to shrink down that unhealthy lifespan at the tail end and basically focus on preventive health. And the key, some of the initiative is about one resident to one GP. Not to see a GP for sickness, but to see a GP for care plan, for to keep themselves active, proper diet, sleep management, and chronic illness management. So that is the preventive health aspect called Healthier Singapore. And the second one is Age Well Singapore. So that was also launched, both of them were launched in 2023. And Age Well, particularly to make our transportation more age friendly, our housing arrangement more age friendly, with a support system enhancing their support as they are frail, going to the toilets, their showering and things like that, to schemes to support them. And as well as making the neighborhood friendly for the seniors, and also creating this social node called active aging centers to promote activities around the senior, but more importantly, social connection. So from 60 active aging centers, in the past 2 years, we have grown to more than 220 active aging centers, encouraging the older people to join this active aging center. So Healthier Singapore, Age Well Singapore. And how do we bring all this together to promote aging in place? We have a simple concept called touch, hold, and care. So how do we touch? Touch is where our silver generation office is where I'm leading as part of the Aging for Integrated Care. I have 9,000 volunteers today, and we go door to door knocking to engage seniors 60 years and above to do preventive health visit. And it's a holistic health, financial health, social health, physical health, psychological health. And we encourage them to do things that what matters to them in their aging. And if they have any needs required, then we will connect them to the service providers in the community so that we can support them to age well and age gracefully. And the whole part is where we hold them in the community together with the active aging centers, as I mentioned before, as well as to join sports activity as part of the Sports Singapore, where we have free gym and pool for youth for 65 years and above. And for those that is younger, actually at very low cost because these are public services. And there's also a health promotion board that have instructors that do exercises in the community, lead exercises in the community for all the Singaporeans. Yeah.
So
So
I wonder if, just for clarification, like,
mm,
what was the impetus for Singapore's turn toward active aging? Were there higher rates of suicide? Were there a lot of deaths at home? What was happening particularly? Just taking a step back.
yeah, there's two curves that we need to bend in short, right? One is like I mentioned, the unhealthy lifespan curve, and we want to keep it as short as possible. The 10.5 years actually is one high medical cost and economic cost. All right. Although you can live it up to 85, but your 10.5 years, that's unhealth. And second one, of course, is the health cost, because you know it's going to escalate. And the way you want to prevent it is to keep people as active as possible for as long as possible and delay the aging effect. So that was the overall arcing strategy, right? So that was two curves that we try to bend to keep it sustainable. And at the individual level and the family level, we can also make sure that the aging is well supported. Right? If they are frail, then we have ways to support them through schemes and policy to age as much as possible in at home and in the community. So there are daycare services provided. There are also to reduce the needs to be institutional care, right? And together with community partners, as well as which I say the care part, which is the regional health system, and of course the GP. So community partners, volunteers, family, and that's where a part of it is also our informal caregiver, like our migrant caregivers that will need to come in. And there are also grants provided to the family for those who are being tested, so as to support them for the seniors or older people who need additional help for their caregiving, right? So that is where we can support those who have, there's some criteria. They may have to meet 3 out of the 6 ADL certified by the doctor. And when the informal caregivers are coming from foreign countries, they also can be given training with the schemes support of a training grant. Yeah.
So when you say 5 to 6 level of ADL, that means that they're still walking, right?
Uh,
They're still able to go to the market and cook, or no?
Yeah. So they could have some issues with feeding, bathing, and things like that. So they have to be certified. So there are schemes and criteria that they can easily access through the Agency for Integrated Care website. And we have a website where support go where, and the caregiver can actually access and then to see their eligibility for these schemes to apply for the support. Yeah.
Can I ask, are the caregivers Singaporean or are they also integrating foreign workers who are also the caregivers?
I would say that in Singapore, particularly, we are still Asian and that family oriented. So a large part, I would say that family is the basic unit of our society. So the care part is still very much supported by the family, but some of the family may need additional help. So then they will may request for a migrant care workers to come in to provide that support and through the informal caregiving part. And if they need to go for a daycare, then this will be provided by the service provider, like partners from Belinda and our friends. They will provide daycare for if they're seniors with dementia, with post-stroke rehabilitation. There are daycare centers in the community. And so these are the kind of facility that created and to strengthen so that to support the older people to live as long and age as long as possible in place and in the community. Yeah.
Okay. So I guess just a clarification because I'm thinking about Thailand and we have a lot of the caregivers both hired and those who are family members. And then we have a subsidy system that assists the family members.
Mm.
And I'm wondering in Singapore, is that the same thing or is that something different?
Yes, there are also schemes to support the family, like I mentioned, through means testing for family who need that kind of informal care support by the migrant care workers. All right. And within their mean testing, they will be given certain amount to subsidize them. But having said that, in AIC, there are also services provided like home-based care, care type of support, including cleaning, taking care of the house, taking care of the seniors, changing of wound and things like that. So they are also bringing the care into the home of the older adult. So that is where the whole idea is to bring the care and the services right at the community and into the home of the older people.
Yeah, thank you so much for, some of these clarifications. Things are similar but yet different in
Yeah.
Singapore when compared to Thailand. I wonder if we can maybe switch gears. I have some questions for Dr. Belinda. So recently, as mentioned before, the Singapore government recognized how many in Asian contexts, right? We prefer to age in place in our home. And so there's probably a quite high demand for assisted living, autonomous living in the healthcare policy. I don't know if you can comment maybe in terms of the kind of systems that are changing and what has been happening and how long this struggle for the recognition of assisted living has been and how are foreign workers maybe integrated in this system.
Hi everyone. Thanks for having me. Thanks, Udarat. I think you're instrumental to getting this session off the ground. Yeah, I think too long to answer your question. Too long. Yeah, but I think just to roll back a bit on what Hock Lin had said, what's the impetus for the government like having now being like really like expediting things compared to previously when things were moving at a very like maybe first gear. Now we're going on to third and maybe fourth gear. Basically, the number of people above 65 living alone in the last decade from 2014 to 2024 has doubled to 87,000. The number of those above 65 in the last decade also increased by 70%. And as Hock Lin said, we are now given the special title of being super aged in 2026. But more alarmingly, the disability rate of those above 65 will increase 5 times in the next 40 years. And the social isolation will increase by 40% in the next 40 years. So these are numbers which the Lee Kuan Yew School of Public Policy has come up with. So basically, we started with the nursing home because in 2010, you know, at that time, that's all Singapore knows. You either stay at home with your helper, or if you cannot cope, you go to the nursing home. But there were good, like maybe 20% of seniors who actually would benefit more from social care than highly medicalized care. So that's when we actually started St. Bernadette Lifestyle Village in 2015 with absolutely no policy support, no no support, and most importantly, no manpower support. We had approached the Ministry of Health, but at that stage, they were quite focused on dealing with seniors, as we said, you know, either at home with a very reduced levy of $60 for their migrant domestic workers, compared to an institution which needs to pay $800, $600 to $800 for the migrant domestic worker levy. So basically, these seniors would deteriorate very quickly in a nursing home environment. So when we had the opportunity to just pilot St. Bernadette in 2015, we did that. It was actually, the whole idea is to care for seniors in actually a sharing economy, in a home-like environment, in the community rather than in an institution. So just to be very clear, I bristle when people say this is an institution, because we are not. It's a home-like environment, and the seniors share a caregiver. They actually share a community space. They eat together. They play their mahjong together. They have activities together. They also quarrel together, but that's fine. It's better than quarreling with the wall. So generally, the whole idea is these seniors are not too different from those who are in the nursing home. They're not too different, and yet they should be different, because our philosophy is dignity and discerned autonomy. All right, so what is discerned autonomy versus reckless autonomy? Because when they have some, cognitive impairment, they go out, they get lost, they actually forget to get their change, they forget to turn off the gas when they cook. So these are like instrumental activity of daily living support which they need, as opposed to the basic ADL support which Hock was referring to. So nobody really talked about IADL support until St. Bernadette. We also didn't know when we started, but we realized that actually seniors stop being able to live independently when they are unable to manage their IADLs. They go out, they get lost, or they forget to turn off their gas, or because of back pain, knee pain, they can't clean their beds, clean under their beds, they can't change their sheets. So they either get a helper or they go in live with their family. But if neither of these options works, then what do they do? So there's a very strong demand for assisted living, obviously, because I think most people, if they had a choice, they wouldn't want to live in an institution like a nursing home. But then the dilemma comes for us is, how do we make it safe for them while still maintaining this dignity, this home-like environment? So I think, like we all recognize, that's what this forum is about. A very important factor is the caregiver. And I don't really agree with Hock that family is the main support for main workforce or caregivers for seniors, because I think we depend heavily on migrant domestic workers. Most people have to work, and even if the whole family needs to work to support the family, they would rather go out and work, even if they don't earn a lot, and get a helper to do the work, mainly because I think it's a very difficult job. Staying at home with a senior who keeps asking you the same question every 5 minutes is very taxing, very trying. So we are actually leaving our migrant domestic workers to this task. And I think I'm going to just go on to the next part, which I feel very strongly about, is that I think these workers, unlike in a nursing home environment where they actually can tap on the senior staff, or they can tap on the doctors and the nurses, they are basically left on their own. So in 2025, we have 300,000 migrant domestic workers coming up to work in Singapore. Of course, not all are for senior care, but I would say not a very small number are actually looking after seniors. So how do we train and equip them? How do we recognize their roles and status? Do we give them career progression? What's their remuneration like? And do we have policies? I mean, I live and work in New Zealand for a bit, and I think I'm sad to say that many of our nurses actually come to Singapore and use us as a stepping stone. And they actually go off to Australia, New Zealand, America, not because we are a terrible country. In fact, if they had a choice, they would like to be here. But I think the very big defining problem for them is the inability to bring their families here. So, most of these workers are ladies, and then, to leave their children and their husbands at home is a very painful decision. So I just met a nurse who was working in Changi General Hospital for 5 years, but now she's quite happy that her husband is with her in New Zealand now. So I think this is something our maybe Hock can bring up to the minister, I think workers need their families with them so that they can actually feel that, this is part of that this actually enhances their work performance as well. But I also understand there's a lot of infrastructure limitations which Singapore has, so that this cannot happen so easily. So these are, I think the other thing is, of course, how do we look after our seniors safely, occupational work safety in a domestic setting.
Yeah, thank you for mentioning that. I think that's something that Thailand also struggles with. We have migrant workers who've been here for over 20 years, but still are not recognized as permanent residents. So it's definitely something that ASEAN collectively struggles with, is the integration of care workers that are essential workers, but at the same time, while we have the benefit of care work for our families, they do not get to have the same benefit. Yeah.
Exactly.
You brought up the thing about safety. That's actually my next question. Maybe you can help answer it first, and then I'd like to hear from Hock about what he thinks about these kind of concerns about safety. So some of it may be about training or certification, and also awareness for both the older person and for migrant workers who may be accepting these kind of jobs for assisted living. What kind of occupational workplace safety needs to be aware on both sides, so that it is much more, all the risks of harm on both sides is mitigated, is minimized. Can you speak a little bit more about the assisted living, the uniqueness to that?
Yes. I think this is a very important topic that is often brushed and swept under the carpet. Because we started from the nursing home side of things, so we were very, very aware about like the workers' requirements, the workers' needs, because they are actually we are regulated by the Employment Act. This is as opposed to a domestic setting where they are not bound by the employers are not bound by the Employment Act. And this is really quite important to delineate. In fact, some operators didn't realize this very big difference. So the line between work and rest is very important, because in a domestic setting, like akin to a home in an assisted living, this line can get very blurred. Right. And when is the worker working and when is he or she resting? I think for us, we are very clear. So we have a roster system where you work for X number, you work for 8 hours a day, then you go off shift. If you do have to have extra time, you're paid overtime. And this delineation between work and rest is something I'm very strongly advocating with the Ministry of Health. Because some operators might not realize this and think that they're just using them like maids at home that they can call on 24/7. The other thing is personal space, because some in this shared stay senior care services sandbox, some operators actually have the workers living in the same room as the senior, which I think is, if we could, I think it's not a healthy choice, because the worker never really gets to rest, and where's the privacy, So I think, to me, I think even if they have to live off-site, I think that's important, because the worker needs time to rest and needs time to recharge. Otherwise, they can't do a good job. The other thing I like to bring up is a little bit sensitive, this disinhibition of seniors as they get older, especially men, sorry, Hock Lin. They actually start to all these inhibitions come to the fore. I mean, ladies also have this problem. They start to scold the caregivers, call them names. They start to have racist tendencies. The men sometimes, start to get a little bit frisky. And this is very, I don't think it's uncommon at all, even in the nursing home. So how do we educate our workers? Because I was horrified when I saw a picture of one of the seniors at my nursing home putting his arms around the waist of one of my workers, and she was very happily letting him do that. And I said, this is inappropriate, because where the workers come from is fine. The grandma, the grandpa, is meant to be respected and all that. But I'm sorry to say, a lot of our seniors, their mindsets are different. How you view foreign domestic workers is quite different. So I think there has to be a very major education drive to teach the migrant domestic workers on their personal safety and boundaries, and for our seniors as well to know what's appropriate and what's not. But hard to tell them when they got dementia. Okay, the other thing I would like to bring up is infection control, because in a nursing home, we are very clear about, all these infection control. But, now in the assisted living space, this line is blurred again. So we have written a good practice guide, but I'm really very concerned, because where you dispose of all the infective material, down the rubbish chute in the HDB flat, is that acceptable? The garbage collector, is it safe for him to collect infective material like that? So these are questions I have been asking. It's going to be it's already mainstream, the assisted living. So I think we need to really, as a society, make sure that we do things right. And the last thing I would like to bring up is mental health for the workers, because, like I said, it's already very stressful, if in a domestic setting. But I think maybe in the assisted living, at least there's oversight. We work on a hub and spoke model. When our workers have problems, they call on the hub, the nursing home. So they're not unsupported, because it's the worst thing is to actually have a problem that you can't solve, and then you don't know where to go for help. Yeah, so I think these are the various things I think we need to be careful about.
Yeah, that's very, important, right? Because, especially the blurring of the lines, right? It's not only between work and rest, but things about infectious, contagious materials that need appropriate disposal, right? So it's quite important. I was wondering if maybe Hock Lin has some comments about this issue on safety and occupational safety hazard on both sides, for both seniors and for those who come and help us.
Let me
Do you want
unmute.
to
Yeah.
unmute?
Okay. Yeah. So I just want to say that first, thanks Belinda. I visited her and she's a strong advocate for what she's doing. And assisted living very thankfully now become like a sandbox, and it will increase that continuum of diversity of care. And I think that space in the whole context of caring for older people will expand. All right. And the shape from actually institutional care to now home-based care and assisted living sits at one space like this, which is unique. And I want to also raise some constraints in Singapore, because like I said early on, not every family can afford an informal caregiver. That is a reality. Even if they can afford, the space is actually a limitation. All right. And because we say in housing development board and the government house, not everyone is having big house. So that's something I want to and 80% of them staying a government housing, like HDB, we call housing development board. So the space could not be very big, and affordability is one challenge, and that's why caregiving could be shared, and maybe they need supervision and things like that, and hence that are some of the key constraint of space, as well as also space in the larger context of the whole country. I'm not speaking on behalf of the government, but these are just as an individual and from a citizen perspective, is that Singapore is really 40 by 40 is just that space, right? It's very different from other countries. So the constraint have to be taken into consideration. The other aspect I would say that once you have a foreign person that stay quite in closely and caring for someone so intimate, there will be cultural differences. And I think that come across every country. I'm sure in Thailand too, where you have migrant workers from Myanmar and all this. And that's where the cultural differences, the nuancing of the language, understanding from one another, and the cognitive ability of the seniors, aging effects that take place actually can cause misunderstanding if not managed well. And actually, that's also one area that I see. But I want to say that I really respect the migrant care workers who came to take care of older people, regardless where they are, because when I watched the movie of a caregiver by our South Foundation recently, I was just touched and moved because a lot of these migrant care workers, they came in to take care of somebody's parents, but actually they left their parents behind to be cared by others. And actually emotionally they are really suffering, or they are actually handling the struggle both way. One is their own parents back at home, the other one is actually taking care of somebody parents where they have to face through all the challenges. And I think the recognition and the respect for this caregiver have to really to be can be done even more and be made known to more people. And I'm very happy to share that some of the community partners have come together to make a movie out of this to promote this and celebrate caregiving by the informal caregiver, migrant worker, as well as the family too. And there are also very moving stories like this, that caregiving is really like care giving. All right, it's also life uplifting. So that's something that we are also thinking about.
Thank you so much. I um it gets me kind of thinking about this, very sensitive issue, right? About, the affordability factor of assisted living, and the subsidies that should be involved, right, for active aging and autonomous living, and also thinking about shift work, right? So, comparatively, I've seen in Taiwan, what has happened is the dependency on elderly care workers who come in as domestic workers, right? And then they are doing double or triple duties, and they are living with ama, sleeping at the foot of the bed on the floor, right? This is very typical. And unfortunately, in Thai circumstances, for many middle class, is also very similar, right? The lack of personal space, the lack of any days off, problems with mental health. When I went to Taiwan, I talked to many Filipinas who had mental health issues because they literally have no day off. And their children, not the elderly parents, were the ones, their elderly parents were taking care of their kids. So we had skip generation, we had a lot of family fractures. And I'm wondering if there has to be a rethinking, right, about how to certify and recognize this is skilled labor, right? At least semi-skilled, and what that might mean for Singapore to have elderly care workers who are, certified in country according to the qualifications that Singapore determines as valuable. And then you can, I think you can integrate a different kind of pay scale that is equitable toward the work. So I was wondering if maybe if you had a comment about that, and then maybe we can have Dr. Stephanie Chok from Home Singapore to talk about some of these issues. I don't know, Dr. Belinda, Dr. Sung, do you have any comments about, issues of certification and semi-skill integration of foreign care workers? Yeah.
Yeah, I think just to share when we actually before we mainstreamed the assisted this shared senior services sandbox, my main kind of like condition for the Ministry of Health and AIC was that the workers needed to be trained, and this was a very hard push because I think for the ministry, they just wanted to get this off as soon as possible, but and they felt that the maybe 3 or 4 hour caregiver training which domestic workers get before their ama comes home would suffice because this is akin to a domestic setting. I was quite adamant that this would not suffice because serving medications to one senior is really different from looking after a group of them. There has to be accountability, there has to be safety, and there has to be doing things right. So the government has come up with a caregiver training grant for this space. We are each company that is on this scheme can get $10,500 for 3 years up to 2028. But I don't know how far that can go, because I think if you really want to train a worker well, you really have to do it well, because all the tasks which were actually done by registered nurses are now being outsourced to they are domestic workers or health aid level of competency. I mean, many of them are actually nurses in their country and they couldn't find other jobs, so they came around to work as helpers. But so having them pre-assessed to see whether they have the language skills, they have the understanding skills is quite important. But I hope the ministry will actually take this seriously and take this on board, because they say if too many of these workers fail, then maybe this is not the right cohort to be in this assisted living space lah. So there is definitely training that's going to happen to equip them for this purpose.
Thank you so much. Hock Lin has some comment and about certification or
We haven't let Stephanie speak. Maybe we let Stephanie go to share your view first. Yeah.
Sure. All right. So I'd like to reintroduce Dr. Stephanie Chok from Home Singapore, and I think she also has some colleagues as well. So without further ado, please unmute yourself. Maybe some
Yeah.
comments.
Yeah,
Thank you.
hi, thank you so much. Yeah, so my colleague Jaya, who's the Director of Casework and Legal, is also here. Yeah, so thank you so much, Dr. Sung and Dr. Wee, for your sharing. I have so much to say, so please rein me in if I go on for too long. So as a young senior myself in Singapore, I am very heartened to know of all the initiatives that are to help me as a Singaporean. But I have to say that when I was listening to the descriptions of what's available for our seniors, I think the disparity is so great to what we see and experience on the ground. So we have healthcare preventive measures, we have ecosystem support, we have all these, we talk about the principles of dignity and autonomy for the elderly, but we don't see this correspondingly in the movements to support migrant domestic workers and migrant caregivers in Singapore. And even the term itself, I think we need to unpack. I think, Dr. Sung, you referred to them as informal care workers. In Singapore, actually, we don't have an informal system. We have a very highly regulated work permit system for domestic workers. We don't even make a distinction between care workers and domestic workers. Everyone comes in on the same work permit, and they are just sort of expected to do most times everything in the home. There are some agencies that try to make this distinction between someone who does care work and someone who doesn't, but generally we just have one indistinguished work pass, and that's actually something that we hope the ministry, and I guess I would like to hear your views as well, Dr. Wee and Dr. Sung, whether or not we should have separate work permits for caregivers to recognize their work as care workers versus someone who comes in on a domestic work permit and is in the household doing domestic work, because we conflate the two. Both are devalued, but care work especially is devalued and not even recognized as care work. And under this very highly regulated work permit system, as Dr. Wee has already pointed out, the domestic workers are not actually protected under the Employment Act. And Dr. Wee, I really appreciate how you pointed out, as somebody who does the hiring, the difference it makes even from an employer's perspective when someone is covered under the Employment Act and when someone is not. I don't know, I'm not sure how much time I have to go into what the work permit regime is like in Singapore, but for domestic workers, there is no family reunification. You are essentially a temporary work permit holder tied to your employer. So their vulnerabilities are very common to other temporary migrant workers in other countries. For example, being vulnerable to being repatriated without advance notice. And the live-in, I think, situation, Dr. Wee has already highlighted how they're especially vulnerable. So at home, we run a shelter for migrant domestic workers, many of whom run away because of the intensity of care work and how the top complaint is often overwork because of this lack of separation. And on top of that, they have to deal with things like confiscation of their mobile phones, not being given regular rest days. If they're given rest days, it's not defined as 24 hours, so they have curfews and they come back, they are asked to come back home very early. So the lack of rest is a key issue. I know that you talked about affordability, and I think we don't deny that there are actually real constraints on many households in Singapore. And that's also because I think if you consider the care landscape in Singapore, how it has developed is that the only financially feasible option for most middle to lower middle income households is to actually hire a live-in domestic worker who can do a wide range of jobs and fill all the care gaps in the household, sometimes including not just the elderly person, but also the young child. On top of which they have to look after the pets and everything else, right? Do the laundry, clean the house. So my broader question there then is, it's our collective responsibility, right, to deal with this. If the situation is such that most Singaporean households cannot afford to pay fairly a domestic worker, and I think I need to point out here that we do not have a minimum wage in Singapore. So domestic workers are still paid salaries $500, sometimes even lower than $500 a month. When it comes to affordability, I feel really compelled to point out that our government imposes a foreign worker levy on every employer in Singapore. The government earns $6 billion a year, 6 billion with a B a year from these foreign worker levies. Now, where do these levies go? Should they be directed into providing and ensuring that migrant workers who work in Singapore are provided the care that they need? So when it comes to affordability, I would say, yes, we cannot not recognize that, but what is the state's responsibility in alleviating that? And how do we adapt or reform the care infrastructure so that there are a range of options? Can we also consider live-out options for care workers and recognize them as care workers? I would also say in regards to the training issue, definitely we run a home academy actually where we are providing training courses at subsidized rates to migrant domestic workers. But training is only one part of the puzzle, right? If you listen to what Dr. Wee was saying, we can train care workers, you can train domestic workers, but if there is not adequate labor protection, if we don't ensure they have adequate rest, we don't have pay that is commensurate with the demands of the work, then you will have trained workers who would just go somewhere else to another country. And what will happen in Singapore is that we will find ourselves with a pool of care workers that are exploited and poorly paid, especially burnt out, and the turnover rates are going to be very high. So it's not a it's not a win-win situation for the caregiver as well as the care recipients, and it's frustrating for everybody. Employers, including the recruitment agents who complain to us about the high turnover rates. So we have to deal with employment agents as well. And within ASEAN, my appeal is that ASEAN does something about recruitment fees. So we are still seeing domestic workers who are paying up to 7 to 8 months of salary deductions, during which time they are not paid. So at the ASEAN level, because this is a transnational issue, I feel that the issue of recruitment fees should also be dealt with.
Yeah.
Yeah. I guess I do have a lot of other things I want to say. Maybe the final one would be in relation to social protection. We talk a lot about the needs of Singaporean households and caregivers outside of just basic labor protections that the caregivers should have, just basic protections under the Employment Act. We don't think further about social protection. We see many caregivers who sacrifice so much to care for Singaporean families and the elderly, and a lot of Singaporean families would say that they are so loyal, they are so sacrificial. She has looked after my grandmother for 10 years, 20 years, 30 years until they pass away, and then they return home with nothing. They have no right to residency. There's no path to permanent residency for work permit holders in Singapore. There's no way they can bring their family, and often they return home without any kind of retirement savings for themselves. So we don't even think about the social protection for when the caregivers themselves become elderly and have to return back to their home countries in ASEAN. So whose problem is that? Is the social protection the problem that the country of origin has to deal with only? Or is it something that collectively countries of origin and countries of destination have to consider? And maybe I'll just end there because I could just go on forever. Yeah.
Well, if you have any of our speakers has any reports or things that they'd like to share to our guests, you can pop it in the Zoom chat. I'm sure that many people might be interested, but this of course violates ILO notion of zero placement fees, right? Many countries do this, right? They legislate in certain percentage is legal in terms of placement fees, and then many migrant workers unfortunately have to work off debt. It's a kind of debt bondage in some ways. Anyway, I do want to open it up for many people who might have questions. I think there might be any questions in the chat, or if you want to just go ahead and raise your hand, people in the room.
Sudhar, while we're waiting for the questions, I just want to comment on something which Stephanie had mentioned. I think the $6 billion foreign worker levy, we are big contributors to that. I think the main thing I would like to say is actually a lot of the migrant domestic workers, while, I'm really empathize with their plight. They're having to come here to look after other people's old people and other people's children and pets. They do come very raw. They do come untrained with a lot of cultural difference, a lot of language difference, a lot of different expectations. So I feel that if we put a foreign domestic worker and an old person together, is putting two vulnerable groups together, which is actually a recipe for disaster. So at least for our nursing home setting and even our assisted living setting, we spend a good 2 years to get them up to speed. This is really a tough job. My husband Joseph, he's a doctor, my partner in crime. It's really like a push and pull kind of thing. You can't get down on them too strong, because they will just get even worse. They get even more frightened. But you can't let them be unsafe around the seniors as well. So for us as employers, it's a very tough job. And I mean, like what Stephanie said, I really agree that this levy which we are collecting, some of it should be used for this kind of support, like enculturation for the workers. How you can actually prepare them to come into a different kind of cultural setting, so that everyone is not so stressed.
or even pathways to upskilling and certification, pathways to having a higher pay salary, right? Or a different kind of work permit, like having a semi-skilled work permit. That's one of the things I think Thailand is trying to advocate for. In any case, I saw that Jaya has, and then John Rosalia, yeah. You can unmute yourself.
Oh, you can't hear me?
I can hear you
Oh,
now.
okay, sure. So my name is Jaya. I work alongside Stephanie, and I oversee casework at home. So, as Stephanie mentioned, we encounter a lot of migrant domestic workers who undertake care work, and some of the trends that we see is they are predominantly actually now and increasingly from one country, which is Myanmar. And the number of workers that we see because of caregiving responsibilities, which they find unmanageable. So, those who have come to our shelter to seek refuge has really increased since COVID. And I think that is in tandem with the aging population numbers that has been talked about by both the speakers. I just want to say a little bit. I think a lot has been said about by both the speakers and Stephanie that is extremely relevant. So I won't really add anything to that. But what I'll talk about is really the idea of caregiver burden. Because right now we are seeing a lot more support and a lot more conversations happening for caregivers in Singapore, but it is still restricted in a way to family caregivers. What is the burden or the financial cost or the emotional cost of family caregivers, which is extremely valid and which needs to be addressed, but what then about, this extremely vulnerable population of migrant domestic workers who are living with the elderly person day in, day out? I think, Belinda, you mentioned that, speaking and listening to one person say the same thing over and over again for the whole day can be very taxing. Personally, I live in an estate that is quite with a lot of old people, and I see this phenomenon where there is a one single domestic worker caring for an elderly person who are living alone. So I'll actually leave a report in the chat. It's actually a report that Home did with a women's rights organization called Aware, in which we actually scrutinized the caregiver burden of migrant domestic
Thank you.
workers
Yeah,
who
that's so.
who are taking care of elderly people. This report was published 5 years ago, and I can say that the statistics, the trends, the issues are still very much the same.
Things have not gotten better, right? Yeah,
No,
yeah,
as
unfortunately.
Stephanie mentioned, we have been toying. I mean, we are not experts in this field. I think there are many other people, such as Belinda and Hoglin, who are very much involved in the eldercare scene in Singapore. We've been trying to advocate for a bifurcated work pass system where, where there's domestic workers and there's caregivers who are living. So I know we are running out of time, so I'll stop there. But yeah, just
Thank you
wanted to
so
put that
much.
report out there. Yeah.
Thank you. So there are two questions. I think John Rosalia has something, but also I just want to read in the chat in case we have a last round go of folks to address the issue of financial allowances for informal family caregivers and the training and upskilling for these beyond the personal caregiver journey. But sometimes it's, both. I mean, we have both the personal caregiver journey of the migrant worker, but also working with the informal family caregiver. But yeah, John Rosalia, you have a question or comment, and then we'll do one last round for our speakers and our commentator.
Yeah, very quick about, I would like to know more about the salary implication, of course. I mean, I think we should not, we have talked a little bit, but Singapore is very rigid for nationality and for type of visa. So there are very clear implications about not recognizing this worker as care worker rather than. And then the issue of, this is ASEAN issue about recognition of different kind of diploma. Like we say, some of them have nursing already, but are these diploma recognized or not in Singapore? We know this is a general issue also for Thailand. So I would like your reaction, if not now, in the next session.
Yeah, I can comment on that. Like I actually answered you, Rosalia. Actually, because of the strong Singapore dollar, even though our salary is low compared to what Singaporeans get, I think people still come here because when they calculate how much they would earn in their own country, it's still fine for them.
Yes.
And the other thing about it, about
Sorry. My worry is more about whether the salary is accordance to the kind of work they do. So the valuation of care work, which is more, and again, domestic work should be valued more. I am also aware that Myanmar workers get less than Filipino workers, get less than Indonesian workers. So we are talking about very low salary. I live in Singapore 4 years, so I am aware of all this. So my concern is not so much the differential, that is, of course, the driving of migration, but whether we recognize the value of this foreign worker for what it should be. And I think this is a general discussion, yeah.
Actually, the at least for the nursing home, the government has put a salary bar. There's a minimum salary that we have to pay our workers. Currently, it's 1,003. Actually, we've been paying them that for the longest time, but they never calculated the housing and the meals that we provided. But we always just documented how much they took home lah. But in reality, the worker needs to live and needs to have a house and needs to have somewhere to stay. But the other thing is political. I think there's always this balance that the government has to strike between getting foreign workers in and pleasing the Singapore core. We have a Singaporean core philosophy in the government, in the philosophy of hiring. This is a bit hypocritical, I must say, because on one hand, you want the domestic worker to work for you at home, but at the same time, you don't want foreign workers to compete with you in the office. So this is definitely hypocritical. And I think I'll be shocked for saying this, but I hate to say this, but I think I have to. It is a form of modern slavery. Having workers here for a dismal salary, doing the work that we don't want to do and not giving them the recognition. But having said that, I don't really have a solution because I can't hire Singaporeans to do the work in my nursing home or in my assisted living facilities. We depend heavily on migrant workers.
Yeah, that's a very similar situation in Thailand. We have a contradiction of protectionism and at the same time a dependency. So some last comments from Hock Lin, and then we'll go to Dr. Stephanie Chok.
I just want to say that first, the issues are pretty complex, and it's not easy to just comment to say that we want the salary, the space, and the protection, because unless we have a really concrete solution to this. But I want to say that from my experience in the COVID crisis, I was in Active SG Sports Singapore, but we actually step up to take care of all the migrant workers that were in Singapore, not just about for the aged care worker, but as well as all the migrant workers. We give them food, housing, vaccination, and care for them. So we even converted our sports centers to be shelters, dormitories. And I want to say that we value all our migrant workers as a citizen, because we really appreciate the work that they have done in Singapore. And particularly all these issues that have been raised, I would say that that's something that everybody is trying to do our best to see how we can level up. And maybe the way to go is really like what Stephanie shared, that at ASEAN level, actually, let's say from training perspective and all this, is there some kind of standard and things like that? Maybe that's something that you all can raise for awareness and also for some kind of benchmarking. Yeah, that's my short comments. Thanks.
Thank you. I mean, certainly things to think about how we live in more multicultural, integrated society, right? Regardless of kind of the skill of the workers who are here with us as really residents. So last but not least, we saved the best for last. Some commentary from Dr. Stephanie Chok from Home Singapore.
Oh, I'm so honored. Yeah, so I do not deny that this is a really complex issue and there are so many different stakeholders involved. I mean, seniors themselves are also vulnerable and often suffering in their own way. I would say that the best form of appreciation, a concrete way to show appreciation, is to ensure that migrant workers get the rights that universally all workers should receive. And that's what I would like us to work towards. I think if we find it difficult to pay what they're due, then let us try to imagine what it would be like if all of them were not around. If all of them did not do the work that we required to do, what would be the economic impact? Can we truly, genuinely put a dollar on the work that we should be paying and imagine what it would be like if they were not there? Then maybe we would realize how essential, how significant, and how dependent we really are. And maybe that would push us to provide the political will to do what is necessary. And I guess with ASEAN, to be honest, I don't really know how much ASEAN has the political will to do. I've attended sort of these ASEAN level conferences, but what I meant was not just political leaders in ASEAN. What I would really like to see is NGOs in ASEAN organizing and collaborating and having more discussions so that we can organize and resist and show that there are multiple stakeholders, including recruitment agents who are ethical and employers who want to do better, who want to change the situation for domestic workers. So that's the kind of ASEAN collaboration that I'm really looking forward to. Yeah, thank you.
Thanks so much. And I hope that our governments, our public health sectors, our public enterprises in active aging also are able to come across, and have larger discussions together. So I wanted to thank everyone. I see my colleague from nursing. I see my colleagues from ILO are here and some of our students. So I'm so glad that folks are here. And thank you. Ajahn Rosalia, do you want to make a closing comment about anything about next time?
So like to thank all the speakers, and I learned a lot about what has been said, and I think this is a topic that whether Southeast Asia or Europe is going to be extremely relevant for the future as we are all aging. I think I am already above the 65 year of age, so very concerned about this. But I think it's a contradiction again. We expect workers to be with us for a long time as we age, as was said, 20 years until we reach the final destination, yet we only want to provide temporary visas for very limited period of time, which doesn't make justice to their importance for them to live as integral part of society. So I am sure there will be a lot to talk more on this topic, and I look forward to the next Wednesday seminar, which will be in 2 months, I think on the same topic or related topic.
Yeah. I think we also want to try to have a conversation on the Thailand side and invite our Singaporean colleagues back. And we'll try to find a way to do it multilingually. So I wanted to invite everybody else to leave. And thank you for joining today. But we will, just wrap it up for now. And I just wanted to say a special goodbye to our guests. So ขอปิด Facebook Live อะค่ะ